The topic of transgender rights has made its way to the forefront of many conversations, with many of those conversations being led by the people in office. Good evening, it's where we start. I'm Nixon Norman. Even more recently, there's been a focus on limiting the access to gender-affirming care and protecting our youth from receiving it. I spoke with a local psychologist about these topics. Now let's dive deeper into some misconceptions. Gender-affirming care consists of services that may include medical, surgical, mental health, and non-medical services for transgender and non-binary people. One of the biggest misconceptions about this kind of care is that it's easy to access, especially when it comes to getting surgery.
I think there's this misperception that somebody could just walk into my office, walk into their physician's office, and they're going to walk out with a prescription for hormones or be signed up for surgery the next day. That's simply not true.
As I mentioned, gender-affirming care spans from mental health to surgery. In order to reach the surgical step, which is often considered the last step in transitioning, a person must go through several rounds of therapy.
On average, by the time folks are receiving a prescription or going in for surgery, they've met anywhere from 2 to 3 doctoral level health professionals with expertise in the area who are evaluating them, who are making sure that this is a safe and appropriate decision for their health care at this time.
One of the other misconceptions is that this type of care, particularly surgical care, is allowed when it comes to adolescents.
What is often touted, because it's so sensationalist in the media, is that kids are getting mutilated or having surgery, and that is simply not true.
A little over a year ago, in April of 2022, Governor Kay Ivey signed Alabama Senate Bill 184 into law. This bill prevents transgender minors from receiving gender-affirming care, including puberty blockers, hormone therapy, and surgical intervention.
Surgeons are not going to put a child down for surgery before their body is finished developing. You know, in general, the age is about 18 or 19 before surgeons, even affirming providers, are going to be considering gender-confirming surgery as an appropriate option.
Meaning that a transgender minor, even with a consenting parent, cannot receive gender-affirming care in the state of Alabama. Other states do allow the usage of hormones and puberty blockers, but there is no state that allows gender-affirming surgery to anyone under the age of 18.